My name's Marisela Sanchez. I'm 24 years old, unmarried. I have a 4-year-old daughter named Jimena. Father's Day of last year, we found out we were pregnant with Sophia. I was having chills, and then that's when I decided to go to the ER. So when they told me I had COVID, I was like, I don't, like a lot of stuff went through my mind because of my pregnancy. And then with the x-rays, they said it could affect the baby. So that day I called my husband and let him know. And I told him, well, either way, I have to get treated. If something happens with baby Sophia, I mean, there's nothing we could do. It's like it's either her or me or none of us.
So Marisela was very, very ill when she was admitted to the ICU. Her oxygen levels were very low in her blood.
She was having difficulty breathing. No matter what methods they tried, it wasn't working anymore. The last thing we tried was to rotate her on her stomach. Even at that, she couldn't breathe well.
And so they decided that they needed to do an emergency C-section in the intensive care unit. Our team prepares for these types of emergencies through drills and being in an ever state of readiness. We have an emergency C-section cart that we keep in labor and delivery that we can take throughout the hospital. We have the backpacks that we call jump packs that are completely supplied with anything that we would need for an emergency delivery. Even though Marisela was delivered here and had an emergency C-section, baby Sophia was in the NICU doing well. Marisela was not doing so great in our ICU.
She was in extreme respiratory failure, and she needed to be transferred to Medical City Plano for ECMO services. ECMO is essentially a lung bypass machine. It takes blood out of the body, puts it through a machine that provides oxygen, and then returns it to the patient. This allows her lungs to rest, and that's what she needed. The collaboration is really what saved her life. The collaboration starts at Medical City Louisville. Then you have a transport team built within our system that's able to bring me to bedside, able to bring a critical care transport team that's able to stabilize her to bring her all the way to Medical City Plano. And there's an incredible collaborative effort through the Medical City Healthcare.
Medical City did not just treat me and my daughter like a patient. They treated us like a family. They provided gatherings for us, like a reunion. When I met her,
en el nombre del Padre,
they helped us get her baptized. And they also gave us a good send-off home with my daughter.
The thing that I love about my job is that I get to make a difference in the lives for the women that we care for by helping my staff make sure that they have all the tools, the equipment, and the resources that they need. And I think Marisela's case is certainly exemplary of that. We were able to provide the care she needed here while at Louisville, and again, be able to coordinate with Plano to be able to give her continued care as she needed it.
They try to treat you like a family member because they go above and beyond for you. Say hi, sister. We're one healthy family. Sophia's 10 months as of now, and I'm glad that we're here with my family.